Over the last few decades, steady progress has been made in the assessment of your heart vessels. The new field of functional angiography has grabbed attention of interventional cardiologists as it promises the new way of assessment of coronary artery disease. Hi, this is Dr. Lakshmi, and you're watching Yashoda Hospitals, the Health Talk session, where all your health-related queries are answered here. Joining our discussion today is Dr. A. Guru Prakash, Interventional Cardiologist from Yashoda Hospitals, Somajiguda. Welcome to the program, Doctor.
Hi.
So, Doctor, many of us are being diagnosed with coronary artery disease irrespective of the age or gender. So what could be the risk factor or causes that we are witnessing this change today?
Yeah, it's a very good question, madam. Recently, we have been seeing young people having heart strokes. They come up with typical angina. They present with acute coronary syndromes, severe chest pain, breathlessness, all these things. So age is no more a standard criteria, limitation. What is the reason for this would be major change in the lifestyle. If you look at the lifestyle of the younger generation, they have a very, very erratic lifestyle. The eating habits, the stress levels, the number of diabetics increasing, number of hypertensives increasing, number of smokers going up, number of drug abuse going up. All these things have a lot of impact on the coronary vessel circulation. Usually the coronary artery disease, heart attacks are proportional to the risk factors. When the risk factors increase, the heart attacks are common. So these risk factors like diabetes, hypertension were common after 50-55 years. Now the diabetes age incidence has come down drastically. And the eating habits, the junk food, all this stuff are adding to the toll.
So as you rightly mentioned, coronary artery disease is no longer considered as a disease for the older age group population. But most of us are asymptomatic for a long period of time, but are being diagnosed with triple vessel disease or a severe form of coronary artery disease right away. So could you explain this for us, Doctor?
We find a lot of variation in the presentations. Some people have typical angina symptoms like chest pain when they exert, and they end up having a normal angiogram. And the angiogram, which is a gold standard in diagnosing heart diseases, it is normal. And some people who are almost asymptomatic for a long time, for some other reason, some EC changes are found or something like TMT is positive. And when we do the angiogram, they have a triple vessel disease. Why this variation? So for this, we need to go in depth to the anatomy of the coronary circulation. See, if you look at the coronary circulation, the epicardial valves, which we see in angiogram, to the microcirculation, that is when the major valves divide into multiple branches and supply, and again they divide into another branch, and they supply the small tissues. So this is called microcirculation. So the ratio between the epicardial circulation to the microcirculation is 1:4. It is almost 4 times the epicardial valves. In angiogram, we find epicardial valves. The microcirculation evaluation is almost not done. The angiogram is just a luminogram. So these people should be evaluated in further by doing a test called functional angiography. This is a latest development in the coronary artery disease evaluation, where so initially when the coronary angiogram came up, it is in 1958, something like that. It evolved over a period of time to this 2024. In functional angiography, what they do is, you know that the microcirculation is four times bigger than the epicardial circulation. They evaluate this microcirculation. This is the answer. Actually, the game is played by this microcirculation rather than epicardial circulation. So on the other hand, you find extreme, the normal, they are asymptomatic and definitely they have triple vessel disease. How do you evaluate this how do you explain this? That's what the question is. These people, though the epicardial narrowing, we look at the angiogram and say it is 90%, 80%. Though there is a 90% narrowing, the coronary microcirculation has got a compensatory mechanisms for this. It's called coronary flow reserve. When there is a narrowing in the epicardial vessels, the microcirculation will adapt to it, like increasing in the surface area, vasodilatation, and so many dynamic things will happen in the microcirculation and leads to the asymptomatic status. It will compensate for the tissue flow. Though narrow epicardial flow is narrowed, it will take blood flow from the other normal epicardials and compensate for this. That's how the reason for this particular thing is explained.
So most of the patients presenting with chest pain are being evaluated with invasive angiography, and the results could be potentially normal coronary vessels. So do you think functional angiography would be beneficial in this kind of scenario, doctor?
Yeah, definitely. There are 2 trials coming up. So they are not, they're favored trial and flash trial, which explains this situation. So to evaluate this, they give a test injection called ergotamine and see if there is a spasm. So if there is a spasm, there is a separate treatment for it. Give nitrates, give nicorandil, all these things will have they are more effective in this treatment. And some people have microvascular dysfunction. They do a test called acetylcholine test in functional angiography. The spasm or vasodilatation in the microvascular, how the macrovasculature reacts to epicardial narrowing is noted in this. So ergotamine test, acetylcholine test, and QFR, all these 3 put together is called functional angiography, and it's an evolving segment in routine angiography, and that's how it helps in some people where you have asymptomatic and still there is a triple vessel disease.
సో ఇప్పుడు మనం ఫంక్షనల్ యాంజియోగ్రఫీ గురించి మాట్లాడినట్టయితే దీని బెనిఫిట్స్ పేషెంట్స్కి ఏముంటాయి డాక్టర్?
ఫంక్షనల్ యాంజియోగ్రఫీ అనేది ఎప్పుడు వస్తుంది అంటే యాంజియోగ్రామ్ నార్మల్ ఉంది, బట్ ఇట్ కాంట్ ఎక్స్ప్లెయిన్ ద సిమ్టమ్స్. టిపికల్ యాంజినా ఉంది, హార్ట్ అటాక్ వచ్చింది, బట్ యాంజియోగ్రామ్ నార్మల్ ఉంది. దీనిలో కారణం ఏంటి అన్నప్పుడు దెన్ వీ గో టు ద నెక్స్ట్ లెవెల్ కాల్డ్ ఫంక్షనల్ యాంజియోగ్రఫీ. దీనిలో స్పాజమ్ ప్రోన్ ఆర్టరీస్ ఉన్నాయా, మైక్రోవాస్కులర్ రియాక్టివిటీ ఎలా ఉంది, ఇవి తెలుసుకోవడం వల్ల రియల్ కాజ్ ఆఫ్ ద యాంజినా మనం కనుక్కోగలం.
సో ఈ పర్టికులర్ ప్రొసీజర్, అది ఫంక్షనల్ యాంజియోగ్రఫీ, ఏదైనా పర్టికులర్ గ్రూప్ ఆఫ్ పేషెంట్స్కి మీరు అడ్వైస్ చేస్తారా డాక్టర్?
ఇప్పుడు ఈ ఫంక్షనల్ యాంజియోగ్రఫీ ఎవరికి ఉపయోగపడుతుంది అంటే ఎస్పెషలీ ఫిమేల్స్, డయాబెటిక్స్ హూ హ్యావ్ నార్మల్ కొరనరీస్, అంటే కొరనరీ ఆర్టరీ డిసీజ్ లేదు, అంటే ఎపికార్డియల్ వెల్స్ నార్మల్ ఉన్నాయి, స్టిల్ టిపికల్ చెస్ట్ పెయిన్ ఉంది, ఇలాంటి వాళ్ళల్లో, ఇలాంటి సెగ్మెంట్ ఆఫ్ పీపుల్లో ఫంక్షనల్ యాంజియోగ్రఫీ చేయాలి. ఆర్ హార్ట్ అటాక్ వచ్చింది బట్ స్టిల్ ద యాంజియోగ్రామ్ ఈజ్ నార్మల్, సో దెన్ ఫంక్షనల్ యాంజియోగ్రఫీలో మనం వీ కెన్ ఇంక్లూడ్ OCT, IVAS ఆల్సో. ఇవన్నీ a group of, it's a called a functional angiography called an umbrella kind, where multiple investigations are necessary to know exact cause of chest discomfort. And వీళ్ళకి మళ్ళా రాకుండా మనం ఎంతవరకు ఉపయోగపడతాం అనేది is the main theme of this.
So before we wrap this episode, doctor, is there any message that you would like to share with the audience out there?
People should be aware of this functional angiography first. They should have basic knowledge about functional angiography. Apart from many people know angiogram. Everyone who comes to a cardiologist now know that they want ECG, they want echo, they want TMT, all the CT angiogram stuff. But they are not aware of this functional angiography. Functional angiography is in latest development. It's a tool, a prognostication tool, and exact cause of chest discomfort or lack of chest discomfort can be evaluated by this functional angiography.
So thank you, doctor, for being here, and it was wonderful having you here on the episode today.
Thank you.
So this brings us to the end of this episode. Don't forget to join us for next week for more insightful discussions on Yashoda Health Talk. Until then, take care and stay healthy. Thank you.